Well, much of the Department of Mental Health's budget request in the next legislature is part of the Smart on Crime initiative that seeks more funding for mental health and drug courts, along with more local crisis beds that will keep the mentally ill out of the criminal court system. Mental Health Commissioner Terry White.
Yeah, one of the things that happens is we have these amazing partners in law enforcement whose job it is when someone's at risk of hurting themselves or someone else is to get them to help. But when we don't provide enough resources locally, when there's not enough crisis beds or hospital beds for someone experiencing a crisis, then law enforcement ends up driving hundreds of miles sometimes trying to find the next available bed or the closest available bed. Well, that's a horrible use of our law enforcement resources. If we got more resources in the community, law enforcement are often the first interaction with someone who's struggling with mental illness or addiction. And if they had a medical facility to get them help right there locally, imagine how much earlier in the disease process we could catch someone. And just like any other disease, the earlier you treat a mental illness and addiction, the better the prognosis. The longer we wait if we have heart disease. If I have 20% heart damage and I wait to get help until I have 50% heart damage, the doctors will all tell you, you're not as likely to have full recovery. Well, if I'm struggling with a disease of the brain where the chemicals aren't being secreted correctly, the longer I wait to see a medical professional to get that taken care of, the less likely I am to have full recovery. But people can and do recover, and they have better prognosis the earlier we get them into treatment.